The mouth is one of the softest and sensitive parts of the face, and as such, it is more likely to be infected or damaged. While the primary goal of the mouth is to speak and eat, many persons use it as a placement for piercing, especially the tongue, while also disregarding the fact that oral piercings can be hazardous to dental health. Dr. Ian Jagan, root canal specialist at Jagan Dental Center, in a recent interview with Nightly News, shared an insight of the dangers of oral piercings and the common side effects, while noting that persons desirous of having oral piercing done should be aware of the risk they are exposed to with these types of piercing.
There are a lot of disadvantages that come with oral piercings. Pain, swelling, bleeding. Sometimes the piercing may get infected, and it can do a lot of damage to the surrounding soft tissues of the mouth and the teeth.
Because of the tongue's vascular nature, he said, prolonged bleeding may result if the vessels are punctured during a piercing procedure. Dr. Jagan also added that other complications can occur with this procedure and may include increased salivary flow, interference with speech and gum injuries. In addition, he noted that the effect of these piercings can also be systemic, affecting internal organs of the body.
Apart from trauma and to the soft tissues of the mouth and damage to the teeth, one of the most severe complications would be if that piercing, that stud gets loose and the person swallows that. It could be life-threatening.
It is advised that individuals with oral piercings should visit their dentist regularly for an exhaustive oral examination to ensure early detection of various adverse effects associated with this practice. Dr. Jagan said that persons with these mouth-altering changes and those considering such should remember the importance of maintaining healthy oral hygiene.
In regard to it being infected, keeping that area clean, preventing food stagnation, which consists of bacteria, that all can cause latent infection. So keeping the area clean is definitely a priority.
He further added that if the gum or tongue is severely infected, constant trauma or damage to the teeth can be the result, and persons should see their dentist or a healthcare provider without hesitation. Oral piercing is defined as a cosmetic procedure of the oral cavity for the insertion of objects such as rings, studs, or pins, where both ends of the jewelry are confined to the oral cavity. Some types of oral piercing include tongue, smiley, and gestural piercings. Reporting for the AGP Nightly News, Joel Vogt.